So in this video, we're going to look at different types of chest injuries somebody might suffer from, and also the treatment that you may be able to deliver. Now, chest injuries can be really serious, as the chest houses many of our crucial organs, such as the heart and lungs, and many major blood vessels. But here's a task for you. Do you actually know the names of all your major organs that you can find in your chest and abdominal cavity? Do you know actually what all those organs do? I'll leave some links and some documents in the resources below so you can use them to help you. And don't forget to watch all the way through to the end so you don't miss out on any important information. Okay, so let's talk about a closed chest injury. Now, this could be where someone's had a car accident and they've hit their chest hard against the steering wheel. Now, most chest trauma injuries, they need urgent medical attention. So you're always going to call for an ambulance for any potential serious chest injury. Now, a common result of trauma to the chest is going to be damage to the victim's rib cage. The rib cage is what protects all those vital organs. And the curved shape of the rib cage does help to deflect some of the force for some injuries, but of course you can still damage the cartilage or the ribs themselves. Now, a single broken rib can be very painful, but a number of broken ribs can lead to other complications. And obviously, the more ribs you break, the worse it's going to be, more painful it's going to be. Now, a victim with broken ribs may take shallow breaths without even noticing, as the body tries to prevent the pain of taking in a full breath. Because if you put your hands on your ribs there, as you breathe in and breathe out, you'll feel they move. So imagine if one of those was broken, it's going to be very painful when you breathe in and you breathe out. Now, when many adjoining ribs are actually broken in different places, the rib cage can actually move in an opposite direction than the chest actually should. And this is known as a flail segment and can make breathing very painful and of course less effective. And the signs and symptoms of this are trouble breathing, maybe even shallow breathing, tenderness at the site of the injury. You might also see deformity where the ribs have been broken, bruising of the chest and pain upon movement. Might be coughing, but really painful when coughing. The lips may go blue, or even the nail beds and the extremities may go blue. They can also sometimes cough up blood, and if you see someone or suspect someone with this, the treatment is always to monitor the patient's airway and breathing and call for an ambulance. Also, you want to make sure you can move them into a position, maybe a seated upright position, something that's comfortable for them. Conduct a secondary survey, and you're going to also be very vigilant and watch out for any changes. We're going to talk more about flail chest injuries in the next video. So they're all closed chest injuries. Let's have a look then at an open or sucking chest wound. Now, this is where the chest has been penetrated by something. It could be like a knife, it could be a bullet, or it could be a falling onto a sharp object. Now, with an open chest wound, you may hear air escaping through the wound. They will also have trouble breathing, and they're going to be in extreme pain, or could be in extreme pain. Everybody has a different pain threshold. You may also see blood in their mouth, or they may cough up blood. Now, the treatment for an open or sucking chest wound is first to assess their airway and breathing. If somebody has something embedded into them, let's say they've fallen on a pen or something sharp, it stays there, you do not pull it out. I'll refer you back to the embedded object video we did earlier on. We're always going to call the ambulance, and we're going to try and lay the patient onto their injured side. Now, obviously, if they've got something embedded in there, you don't want them laying on the embedded object, but lean them over more to the injured side, because that's going to prevent any complications with their good lung. So you want the good lung higher. You're going to treat them for shock, and you're going to carefully monitor them, and obviously update the emergency medical services if there are any changes for the worse. Now, back in 2016, rules for first aids were changed on sucking chest injuries. Before 2016, we used to use special dressings to cover the chest wound. The advice is not to do that anymore. So we're going to leave a sucking chest wound open as a first aider, because using dressings, used to be a 3-sided dressing, there's actually a higher risk that you'll do more harm than good. So for now, we're going to leave the wound and provide care to the patient and get the emergency medical services to them quickly. Now, of course, if you do know what you're doing with a three-sided dressing and you've been trained to use one correctly and you know when you should be using it, then of course that would be useful. But if you're not trained, please don't, and just leave it open and leave the professionals to deal with it. Our job as a first aider is going to be able to stabilise the casualty and to reassure the casualty. Okay, so that was open chest wounds and also closed chest wounds. Don't forget to hit that subscribe button so you don't miss out on any of our important videos.